Dear colleagues, what a day of ASCO 22 with an amazing plenary, starting off with the Phase 3 Destiny Breast 04 with a concomitant publication in the New England, trastuzumab deruxtecan in previously treated HER2-low advanced breast cancer. Patients were randomly assigned in a 2-to-1 ratio to receive trastuzumab deruxtecan or the physician's choice of chemotherapy. The primary endpoint was PFS in the HR-positive cohort. The key secondary endpoints were PFS among all patients and OS in the HR-positive cohort and among all patients. Overwhelming results leading to a standing ovation. Trastuzumab deruxtecan results in significantly longer PFS and OS versus chemo. PFS 10.1 versus 5.4 months, OS 23.9 months versus 17.5. That is a 6-month increase in the OS. The safety profile was similar to prior trials, and with the majority of patients have received more than 3 lines of therapy in the metastatic setting. This is a clinically significant milestone that is fundamentally changing the way that we define the disease. Dare we say, game-changing. Our congratulations to the investigators and thanks to all the patients that participated. Following with the Paradigm trial, the largest randomized first-line study to prospectively compare the efficacy of different targeted therapies in combo with standard doublet chemo based on tumor sightness. The results saw panitumumab plus FOLFOX had longer OS, higher ORR, and higher curative resection rate. I think this result shows that panitumumab is the preferred targeted therapy to use in upfront combo with FOLFOX in those with left-sided RAS wild-type metastatic colorectal cancer. The Recur trial, a phase 3 prospective randomized study in relapse Ewing sarcoma evaluating topotecan and cyclophosphamide and high-dose fosfamide. This trial closed early due to results and found EFS and OS were better in high-dose fosfamide. A 5-month difference in OS, 10.5 months versus 15.4, and EFS 8% versus 14%. The Phase 2 NADIM-2 trial in neoadjuvant chemotherapy plus or minus nivolumab for resectable stage 3AB non-small cell lung cancer. The trial saw that there was improved PCR observed in those treated with neoadjuvant nivo plus chemo versus chemo alone. PCR 36.8% versus 6.9%, and PR is 52.6% versus 13.8%, ORR 75.4% versus 48.2%. There was no increase in the rate of high-grade AEs and increased the rate of surgery versus chemo alone. In this oncologist opinion, the results from the NADIM-2 trial strengthened the findings from Checkmate 816 and confirms the superiority of neoadjuvant nivo plus chemo in resectable stage 3AB non-small cell lung cancer. And there you have it, folks, your roundup for day 3 of ASCO 22.